Good afternoon. I'm Dr. Dale Bratzler. I'm the Chief Quality Officer for OU Health, and I'm also the university's Chief COVID Officer. I'm going to go through a handout that we've sent out, which just has some of the information I'm going to cover today. I'm going to start off by talking about some of the good news in Oklahoma, and then I'll talk about some of the challenges that we could potentially see going forward. So I think there's a lot of good news in Oklahoma right now around COVID-19, and I think all of you have reported on it before. Oklahoma is currently ranked 45th in the nation with respect to the number of new cases in the country, at only 8 cases per 100,000 population per day. And just to put that in perspective, we were at 103 cases, new cases per 100,000 population a day in mid-January, so that number has come down tremendously. I will point out, though, that there's still substantial variation between states in the United States. So Michigan, which currently is seeing the largest increase in the number of cases, is at 57 new cases per 100,000 population today, and New Jersey's at 50. So again, there's a lot of variation between states. There's still a lot of COVID in the United States. Oklahoma reported 413 new cases today. That brought the 7-day rolling average up only slightly to 325 new cases per day on average over the past week. I would say that we've plateaued. The number of cases, new cases per day, is very slightly trending down, but really we've been in the mid to low 300s now for the past week or so. There continues to be variation by county. Yesterday, the State Health Department updated the county data, and right now, Tulsa County is quite low at 7 new cases per 100,000 population per day. Oklahoma County is at 9 new cases per 100,000 per day, and Cleveland County's at 11. The highest county in the state is Cimarron County, but they have very, very few cases because of the population density, and perhaps the county that's seeing the most new cases right now is Comanche County down in southwest Oklahoma. When you look at testing in the state, the total number of tests that are being done has come down. This week, only 3 days worth of data so far. Only 2.5% of all the specimens that have been tested are coming back positive right now, which again is very, very good news because we were at higher than 19% in December. So that's really good news. That tells me we have much less community spread of the virus. And hospitalizations have largely plateaued. We're staying right around 200 people a day in the hospital. I do want to highlight in Oklahoma that we're still seeing more than 2,000 Oklahomans per week that are newly diagnosed with COVID-19, and we expect a percentage of those people, anywhere from 8 to 10% of those people, to end up in a hospital. So we're still going to see hospitalizations for some time to come. The other piece of good news that I want to highlight is the number of vaccines. So I looked at the CDC website this morning. Oklahoma has administered 1.9 million doses of the vaccine. Approximately half of the people above the age of 65 have now had at least one dose of the vaccine. But as we might expect, that younger age group that had the most cases, that 18 to 35-year-old age group, only about 7 to 10% of that population so far in Oklahoma have received the vaccine. And of course, we've opened up vaccination this week to all of eligible people, all residents of the state, so we should see those numbers come up a bit. So that's the good news. Oklahoma has seen this tremendous drop in cases, hospitalizations. They're all down more than 90%, which is really good news. And I think as a whole, the state is doing very well at distributing vaccines. But there is some bad news. I think a lot of people knew in the national news that the CDC reported yesterday that the mortality rate in the United States between 2019 and 2020 went up 15.9%. Most of that attributed to deaths from COVID-19. In fact, in 2020, COVID-19 was the third leading cause of death, only behind heart disease and cancer in the United States. And in the elderly, a devastating impact, more than 1,800 deaths per 100,000 population in people who are 85 years of age or older. This respiratory virus is a bit different than influenza in that influenza tends to kill the young and the old. This virus has very much attacked old people in the United States, the elderly. In the handouts, I put the pneumonia, influenza, coronavirus curve that comes from the CDC's National Center for Health Statistics. And again, you can just simply glance at that graphic and see the huge number of cases and deaths that have occurred in the United States during 2020 because of COVID-19. And in fact, if you saw the article that came out from the CDC yesterday, there were big increases in the number of COVID deaths in 2020, particularly in the months of April and in the month of December. So a devastating impact of COVID-19 this past year. The other point I'll make about deaths from COVID-19 is that they definitely have disproportionately affected people of color. The highest rates of death in the nation were in American Indians and Alaska Natives, followed by Hispanics and by Black Americans. So again, disproportionately affected persons of color, and again, highlights our need to make sure that we're promoting vaccination for those populations. A couple of other points I wanted to make. So I have been giving a number of talks on COVID-19 and again, highlighting the really good news in Oklahoma on the number of cases. But I also have developed a few speaking points on what could go wrong. We're doing well now, but what could go wrong? And I think the biggest thing that could go wrong is that we get too lax, we let our guard down too quickly here with respect to the number of COVID cases. So again, let's just highlight what's happening in the United States. In the United States, we've seen a 17% increase in the number of COVID-19 new cases in the past 2 weeks. So they've gone up substantially, not in Oklahoma yet, but they have around the country. Michigan has seen a 124% increase in the number of COVID cases in the past 2 weeks. Florida has seen a 15%, a destination where a lot of people have gone for spring break. So Florida has seen a big increase in the number of cases. And while Texas, their number of cases has been down for the past 2 weeks, if you look at what's happened over the past 4 or 5 days, they're starting to see an increase in the number of cases in Texas. So COVID-19 is not gone. And in parts of the country, particularly the Northeast, Michigan, Minnesota, Florida, there have been big increases in the number of cases. So that's the first thing that could go wrong. We can't let our guard down, and we've seen it happen before. Cases go up on the coast, and that slowly trickles into mid-America. So we just can't let our guard down. The second thing that could go wrong with all the great things that have happened in Oklahoma are variant strains. 5 different variant strains have been identified in Oklahoma to date. The good news is that we haven't seen too many cases that have been identified, though we haven't been doing much genomic testing. The one that concerns me the most is the South African variant because it doesn't seem to be prevented as well by the antibodies you get when you get the COVID vaccines. Luckily, we've only had 1 case of that confirmed in Oklahoma so far. But remember, any mutations that occur to this virus, and mutations occur when the virus is transmitted from person to person, can increase the virulence of the virus, and particularly the ones that we're worried about are mutations to that spike protein. That spike protein is the protein that attaches to the human receptors. The third thing that could go wrong, we don't know yet whether the virus that causes COVID-19 will be seasonal, like the flu. Coronaviruses are cold viruses. And there are 4 different coronaviruses that routinely infect humans, and we know that they're all seasonal. They go away in the spring and summer. So this huge drop we've seen in Oklahoma, how much of it is just the possibility that the temperatures are getting warm? We're to seasonal drops in the number of cases, so that's a possibility. Will this virus be seasonal? Will in the fall and winter we see outbreaks? I think we're always going to see some endemic cases of COVID-19, and they could be people, just individuals who get COVID-19, or people who are particularly sick, immunosuppressed that get COVID-19, or we could even see some outbreaks in people who are unvaccinated. So again, another reason to promote vaccination. But COVID-19 is not going to go away, and the big question is, just like the Spanish flu in 1917, 1918, will we see a resurgence of cases in the fall and winter months? And then lastly, I wanted to highlight an article that was published in The Lancet that looked at natural immunity. So I know a lot of Oklahomans have already had COVID-19, And we know that when you have COVID-19, you develop some level of natural immunity against the virus. But a very interesting study out of Denmark that looked at 4 million people showed that even in people who have previously had COVID-19 positive PCR test, they looked at them more than 90 days later, and they found that a proportion of those got reinfected. So previous infection was about 80% effective at preventing reinfection beyond 90 days. But in the elderly, people 65 years of age and older, it was only about 50% protective of keeping them from getting COVID-19 a second time. So are we going to have to be concerned about repeat infections with COVID-19 in people who may have had it before? And once again, highlights the need to get vaccinated. Even if you've had COVID-19, when you take the vaccine, you get a huge spike in your antibody levels. It really boosts your immune system and could help us potentially prevent repeat infections down the road. So that's kind of the key. And then the last point I wanted to make is, you know, the last thing that could disrupt us would be, what if Oklahomans, what if enough don't take the vaccine? What if we get to maybe 40 or 50% of the population vaccinated, but the rest, for whatever reason, don't? We know there are a lot of reasons that people don't take the vaccine. Vaccine distrust. Some people just don't take vaccines in general. They won't get the flu shot. They're not going to get the COVID shot. Some people have been concerned about the rapid development of the vaccines, and while I think it was done very scientifically and appropriately, people have had that concern. Is the vaccine effective? Are there side effects? We know that people have short-term side effects, but so far, all the long-term studies that are available, at least, have shown the vaccines to be very safe. There's tons of misinformation on social media, and I think that's been a real challenge. And then, how many people are going to have long haul syndrome? You know, when I talk to people who contact me about long haul syndrome symptoms, most of them to a person say, if I could have taken a vaccine, I would have. But it's one of the concerns that could disrail our really great improvements with COVID-19 in Oklahoma if we don't see enough people keep taking the vaccine, so we need to keep promoting it. Finally, the very last slide, I want to highlight something. I was looking at Facebook last night, and I saw a post by one of the local reporters who was proudly showing that she had finished her COVID-19 vaccine series, and there were hundreds of comments about it. But as I scrolled through some of the comments, what I saw immediately was those people who said, well, you still have to wear a mask, so why get vaccinated? I mean, if I have to still wear a mask, what's it worth getting vaccinated? Just completely inappropriate, and it's part of something that's called vaccine alarmism, that people don't understand that there are other reasons that we get vaccinated. So I want to make it absolutely clear. The primary reason you get vaccinated is to keep from getting COVID-19, and if you happen to get it, because no vaccine's perfect, you won't get nearly as sick, you won't be hospitalized, you won't have complications, and you won't become another death statistic. That's why you take the vaccine. There was never any guarantee that if you're fully vaccinated, you'd never have to wear a mask. We've already highlighted that people that are immunosuppressed, people that are older, may get reinfected. So I think masks will become common, certainly in certain settings. When you're around a lot of people, people who are particularly ill, if you have family members with cancer, you probably should be wearing a mask to protect them. So there was never a guarantee that just because you're vaccinated, there would not be some need to wear a mask periodically. You take the vaccine to keep from getting COVID, to keep from being in the hospital, and to keep from dying from the disease. So I'll stop there.
When you were talking about the possibility that you don't know yet, one of the things that could go wrong is that it may be seasonal like the flu. What is, I mean, are they looking at the research of if we need to get, every year we get our flu shot, we get our COVID shot, but like, would it be a series again, do you think, or did it haven't even gotten that far yet?
Yeah, so we're,
one.
yeah, so the question largely gets to, if this happens to be a seasonal virus, it comes back every fall and winter, or we see more cases, Will we need to get a booster shot periodically like you do with a flu shot? Because with the flu shot, the virus changes every year, so you get a different vaccine every year. And we simply don't know yet. I think it's going to depend on what we learn about long-term immunity after you've been fully vaccinated. I think it's going to depend on how many mutations we see with the virus. Are there variant strains that aren't protected because you've been vaccinated? So there may be a need to take either a booster shot of COVID vaccine in the future, or what we would even consider a multivalent COVID vaccine, one that protects you against multiple different variants of the virus. But nobody knows at this point, because we don't simply know what the natural history of the virus, the disease, or the length of immunity from being vaccinated is going to be. I think it's unlikely that you would have to take a full series again, but I don't know. And the other thing is, will there be certain subpopulations? Will it be recommended as an annual vaccine for the elderly, or people who have underlying conditions that put them at high risk of the complications of the disease? So a lot more to learn going forward.
So in that case, it would be more like a pneumonia vaccine, right? Specific populations, I guess. That's interesting. Can't wait to see what happens. Okay, lots of questions, and more have been coming in. Let's talk about vaccination first, since we're kind of in that mode. Have we, or are we reaching a plateau of people wanting to vaccinate? We're seeing large vaccination clinics with only a few people in line wanting to vaccinate. What does this mean for our state in reaching herd immunity?
Yeah, so one thing that we've noticed in some of our events is that they don't always, all the appointments that we have available or the doses we have available aren't signed up for. And I know they're seeing that at the fairgrounds with some of the big events that are happening. I think the people that really wanted to be vaccinated, who knew they needed to be vaccinated, a lot of them went out and sought it and found it and have already been vaccinated. And so I think we're going to see more of these large events where we don't completely fill up all of the appointments. For me, what it tells me is we need to continue our efforts to both promote the vaccine, but also to promote it in areas for disadvantaged populations that may not have the ability to sign up online, that may not have the transportation to get to one of these large events. So going into the community. I've highlighted before, I think we need to get the vaccine in doctors' offices, because there may be patients out there who are very high risk for COVID-19, but they want to talk to their doctor first before they get the vaccine. And it's the ideal time when they're in the doctor's office to potentially get the vaccine. So I think that's going to have to be a part of the approach going forward.
We're hearing of some clinics having to toss out supply because not enough people showed up. Can you talk about what our process is for that?
Yeah, so the question is, are people throwing out supply if they don't have enough people show up? I certainly hope not. The process that we use here at OU Health for any of our events, similar to what we did down on Norman campus this past Friday when we had 4,000 appointments. By the way, we didn't fill all 4,000 appointments. We project how many people are coming in through the day. We watch the numbers coming in all day long. We look at how many people had a scheduled appointment that didn't show up. And so we draw a limited number of the doses up from the vials as the day progresses. And as we get to the end of the day, then we only draw up vials as we have arms to put the vaccine in. So sometimes it slows us down just a little bit at the end of the day, but we don't waste doses, we don't waste vials. If we don't have the people show up, we simply keep those vials either in the refrigerator or frozen, depending on which vaccine it happens to be. We just don't waste vaccine.
Excellent. And you've talked about the vaccine hesitancy some, but this reporter just wants to know if you're concerned about vaccine hesitancy and whether you are monitoring data for that, or if there's any data for that information.
Yeah, so the best data that we have right now comes both from the State Health Department and the CDC on the number of people that have taken the vaccine. So again, we saw pretty good uptake by those people 65 and older. At least half of Oklahomans above the age of 65 have been fully vaccinated, completed the entire series. But that means half have not. And I do have concerns that there is going to be vaccine hesitancy in the state with some populations. Again, I think it's very, very important we keep promoting it. I think as more and more people see that it's safe, that it works, it keeps people well, that it lets us start opening up things like reducing the need to wear masks or do social distancing in certain venues, I think people will come on board with it. And again, I think it's very, very important that the vaccine's broadly available in doctors' offices and pharmacies and other places where people go so that they can get the vaccine. And if they have questions, they can talk to somebody so they understand it.
This one says, can you address why so many people are posting online that the second shot feels worse than the first and is making people feel weak and even ill for a day or two? How is this happening if it's the same spectrum?
Yeah, so in fact, in the clinical trials of both the Moderna and the Pfizer vaccine, in both of those clinical trials, they showed that the second dose was associated with far more symptoms than the first dose. As you mentioned, usually short-lived, a day or two, and it's because you're boosting the immune system. So those symptoms of weakness, fever, chills, body aches, those aren't side effects of the vaccine. That's your immune system working. And so you give the first dose, you ramp up the immune system, and then 3 or 4 weeks later you give a second dose. Now you really stimulate the immune system, and that's why you have more symptoms after the second dose typically than you do after the first dose. Again, it's not adverse reaction. It's side effects that simply say that your immune system is reacting to a foreign protein. You're developing antibodies and that T-cell immunity that will protect you for the future.
Okay, you talked some about data. What are your thoughts or reactions to the state saying that daily data is not particularly helpful at this point and has artificial swings that are meaningless?
Well, so as I've been vocal about in the past, I think the daily data is useful, and I completely agree with the state that in many of our smaller counties, the day-to-day swings are meaningless. I get that. But I don't think day-to-day swings are meaningless in Oklahoma County, Tulsa County, Cleveland County, our larger counties in the state, where we see quite a few cases that are diagnosed every day. So again, I know that the health department still captures the data. I know they still have to report it to the Centers for Disease Control. I would just wish that we were still transparent with it. I use it in my role as the chief COVID officer for the university because I have campuses in Norman, in Oklahoma City, in Tulsa, and all 3 campuses are in fairly large metropolitan areas where day-to-day numbers actually are meaningful.
Just kind of an extension of that was that what are your thoughts or reaction to the state saying it wants to provide more analysis in the weekly reports but can't do that and produce daily data?
Yeah, so I'm all for the state health department producing more information in the weekly reports. Again, I think all of us are adapting to what we're currently getting in terms of data, and I'm not criticizing because I do know it takes resources to produce those data reports. I would hope that in the future, as the state's information systems are updated, that kind of information can be automated so that it goes to a dashboard rather seamlessly.
So you talked about this quite a bit at the beginning, so maybe just if there's anything else you want to say about it, but that states in the Northeast have been seeing the sudden increases in cases. Oklahoma and Texas, however, have not. Any ideas or theories as to why that's happening, and could this happen to Oklahoma eventually too?
Yeah, so there are lots of different theories about why the Northeast, so New York, New Jersey, Connecticut, some of those states are seeing fairly substantial increases. They're still in the northern hemisphere. I mean, they're in northern climates for the United States, so maybe part of it, because as I've mentioned, there may be some seasonality to the virus. So they're in colder parts of the country that activities may not have moved outdoors as much as they have in Oklahoma. That may be part of it. Some of those are very dense population centers. So Michigan has some very dense population centers like Detroit that where you could see community spread of the virus. There are more variants in parts of the country. So particularly in the Northeast, they've seen a lot more of the UK variant, which, as you know, is more transmissible between people who aren't vaccinated. I don't think all of those states have done as good of a job as we have with respect to getting doses of the vaccine out. And Oklahoma, let's just face it, we're a much more rural state with a spread out population. We don't have the population density that some of those states that are seeing increases. Again, for Texas, I'm going to highlight, if you look at the 2-week average, their cases are down. But over the past few days, they've seen a fairly significant increase in the number of cases per day, their 7-day rolling average. So we just need to keep watching carefully.
And is it too soon to lift restrictions?
Yeah, too soon to lift restrictions. Well, I think we need to be smart about it. You know, I don't think you need to be wearing a mask if you're doing most activities outdoors. I don't. We already have good research that shows that the risk of getting the infection outdoors is dramatically lower than indoor. But if you're going to be at an indoor event with a lot of people, you don't know their vaccination status. You simply do not. So I think it's a common courtesy to wear a mask. One of the things that Dr. David Kendrick with his My Health data has been able to show is there's a dramatic difference in the rate of flu test positivity in communities that have mask mandates versus those that do not. Communities with mask mandates have much, much lower rates of positive tests for the flu. Masks prevent the spread of respiratory illnesses. So again, if you're indoors around people you don't know if they're vaccinated, I think it's a common courtesy still to wear a mask, and we should do that and be cautious about reducing some of those mitigation strategies. The other thing, remember, I wanted to highlight that older people may be more susceptible to reinfection, and certainly we know that people who are severely immunosuppressed, like transplant patients, some cancer patients on chemotherapy, even if they've been vaccinated, the vaccine may not work as well in those patients.
Last question. As COVID goes down, travel increases. Thoughts about that?
Yeah, so I think lots of us are looking forward to being able to travel again, and the tremendous drop in COVID cases has made it much more appealing. I think the airlines have done as much as they can to make the airlines as safe as possible. Just remember some of the common rules. If you're going to travel by air, you're required to wear a mask. Remember, air, bus, or train, you're required in the United States still to wear a mask. But wear it once you get to the terminal throughout your whole trip. Think about where you're going. New York, New Jersey may not be the best place, or Michigan may not be the best places to be traveling to right now. They have much greater risk of transmission of the virus. Think about the variants. Some states have had many more cases of the variants. So Florida is starting to see an increase in the number of cases again. They've had quite a few of the variants, particularly the UK variants. I think you can travel safely, but try to avoid large indoor crowds, particularly in places where people aren't wearing masks. Doing activities outdoors, I think, are quite safe at this point, and I look forward to traveling more.
One more came in. You mentioned 5 variants are present in Oklahoma. CDC still shows 1 case of P1 variant. What's the difference?
Yeah, so in fact, both GIS and CDC are both showing only 1 case of the P1 variant, which is the Brazil variant of the virus. There have been, I think, 10 or 11 cases of the UK variant that have been identified in Oklahoma. There's been maybe only 1 case of the South Africa variant, and then there have been a couple of the California variant. Remember that we have California variants, New York variants, Louisiana variants that are in the country. I think 2 cases of the California variant have been identified in the state. So CDC is reporting on just 3 variants: UK, South Africa, and Brazil. But there are other sources of data that are checking for other variants in the state, and I know at the state laboratory they've identified additional variants in the state. So again, the good news is, despite variants being present, our case counts are still staying low and have come down a lot. So right now we haven't seen any big impact of it, but that's not true in other parts of the country.
Anything you need to add?
I don't think so.